Good morning or good afternoon. This is Tim Todak with HDX WILL, and today is the last part of our e-learning series webinars on some of the uses of HDX WILL imaging and on-demand functions. So by popular request, we were asked to do a webinar on evaluating the airway so that you guys get an opportunity to be able to see how a CBCT and how HDX WILL CBCT especially can help you be able to visualize the airway and be able to give you that many more ways in which you can not only document your treatment, but be able to see some results as well. So as we move on with this, I'm going to kind of show you a number of different things associated with the way that we can do this. So in the beginning, obviously some housekeeping. This will be recorded. So if you can't make all this meeting, that you can get the recording and be able to download it and watch it at your leisure. Give it to your friends, anybody else that has one of these or is thinking about one of these, just simply because of the fact this gives you some ideas to what CBC can really do for you and your practice. So moving on, that one of the unique things about HDX WILL and our machines is that we have a very large field of view. Now, as we start talking about airway, that becomes significantly important because you have to be able to visualize the whole airway to really get an idea as to what's going on with there. So to give you an idea, I've pulled up some pictures on being able to see what we can do. So our traditional or our smaller classic size is a 16 by 8 or 16 centimeters by 8 centimeters. That'll be 8 centimeters top to bottom, 16 side to side. Now, the benefit of that is that you can see that we can get the whole dentition all the way up to the TMJ. With that in mind, we can also visualize the airway. Our larger field of view, larger maximum field of view, is the full face 16 by 14.5. And again, that 14.5 gives you from mid-forehead all the way down to the epiglottis, but then it also gives you all the way around surrounding the head itself. So to give you an idea, the 16 by 8, again, from hard palate all the way down to epiglottis here, and this is the bone version of that as well. So again, you can see all the bony structures of the dentition, but that if you're doing airway especially, it becomes increasingly important to be able to get this whole section right here. If you start getting a smaller field of views, if you're going from 16 to 14 to 12 to 10, now depending on your patient's positioning and your patient's size, you're going to get into an issue in which you may or may not be able to encompass the whole airway and then be able to get that same measurement, the same visualization that you're looking for here. So it just kind of gives you some ideas. And again, with a larger field of view, you can see you can encompass not only from the sinuses down, but you can be able to see all the airway as it comes across. Now, with a smaller field of view, if you wanted to be able to see the sinus areas, then we can reposition the patient and make it to where, again, now we have a different positioner in place, and now the patient's sinuses are going to be much more involved as far as the visualization is concerned. And so you can see, we can see a little bit higher and focus on the maxilla and in the sinuses as well. So you can do it with a smaller field of view. It's just that it may be possible if you have to visualize the sinuses to be able to have to take 2 scans as opposed to one with a larger field of view. So now going on further, we're going to go ahead and get right into a case study so we can play with it a little bit. So as we go in, just going to go ahead and open up our on-demand like we've been doing, and let's kind of take a look and see what we can do here. So as we move along, that here's our scan as it originally shows up. And again, if we're evaluating for airway, we can immediately see the patient's airway because it's going to start center and center, so we'll be able to encompass the airway. So now, as we look at the airway, we start to think of being able ways to measure it and to take a look at it. So in this case, as we look at it from the sagittal view, we can see that not only we have the nasopharynx area here, but then you also have the area around the back of the tongue. And that's pretty much where, in this person's case, the stricture is encompassed is right in this area. So with that in mind, that we are able to take a look at that area in particular on a cross section, as well as being able to look at the whole airway in general. So again, we can go through, and this blue line is going to indicate what my axial is. So I'm going to actually move that blue line right down to where the stricture is. Once I'm at the stricture itself, then I can be able to take a look at that area. So this will be the area right where that line is, and that's where my stricture is the tightest. So I'm going to go ahead and blow this up and kind of take a look at it. So looking at it in cross section, we can see where the back of the tongue hits and the soft palate, and so we can go ahead and let's go ahead and make some measurements there. So in this case, I'm going to blow this up from my ease of application here. So we have this here. So again, if we're doing like a pre-treatment evaluation, we can go through and we can make some easy measurements, taking the area of the smallest area. When you take the area that you have the ability to be able to look at, yeah, be able to look at it in different ways. So I clicked area on here, and then I have different tools to be able to do that. So I can either use as a line pin that's going to kind of connect lines together, a curve pin that's going to make curves to kind of fit the area that you're looking for, and a smart pin. I prefer the line pin personally, but it's just what I prefer to do as I've learned. So we can start here, and again, make individual clicks along the area in which you have your slightest point. Trying to get at least as much detail as you can within your line structure. Coming up over here, cross over here, cross, and then double click to finish off your polygon. And this is going to give you an area measurement. So now what we can do in our notation of this patient is pre-treatment, that area where the tightest stricture was is going to be 260 millimeters squared. So that gives me the ability to say, that I have a starting point as far as that's concerned. So that's a good way to be able to at least evaluate in the tightest area and be able to get the area. So now some of the other things we can do, and I'll minimize this back down again, some of the other things that we can do is, again, as I've talked about before, is I like to create a story. I like to create something so the patient understands more about their treatment and their cause. So what I can do is, you can see as I scroll through here, I can actually open up the nasopharynx a little bit further in. And so remember with our CPR view, we can essentially make an endoscopic view of this area. So what I can do is I can go through, click on CPR, and plot points in that area, turning around the nasopharynx, back of the tongue, epiglottis, into the airway. When I double click, now we're into this area here. Now, because I'm looking at a negative space, I need to put some soft tissue around it to be able to see it better. So what I'm going to do is I'm just going to add some soft tissue to it. And then when I click on Airway 1 in CPR, this now gives me the ability to be able to see like an endoscopic view what's going on. So you can see here, I'm now in the nasopharynx. So here's the septum here, and I'm in the left nares, and I'm going to go down. As I get to the turn of the nasopharynx, I see a tonsil here, and a tonsillar fold there. But then we can go ahead and make the turn around. And again, you can right click to be able to move that left to right, so we can be able to kind of see around and see what's going on. Now, really interesting, you can see the back of the soft palate laying on top of the back of the tongue here, and you can differentiate those two soft tissue planes. And then here's actually where our stricture is as well. So again, not only do you get to endoscopically visualize it, but that you can also be able to show your patients so that you say, as your air goes in here, you can actually see where this is the tightest point where the back of your tongue is, and that's where your stricture comes from. And again, we can even go through and be able to give them a visualization as we fly through to show them that this is where your airway goes and eventually has to go in through your epiglottis and into your airway itself. So again, this gives some great visualization options to be able to teach your patient about their problem, but also gives you the ability to actually take it almost like an endoscope and be able to look inside there, to look at the soft tissue structures and be able to evaluate it from a visual perspective for you. So moving back to 3D MPR, that now we can do things to where we want to be able to maybe measure the area that we want to be able to do in a sort of a volume. So again, if we're doing a treatment plan, we want to be able to measure all these things before, and then maybe after treatment, be able to go back, take a CBCT, and be able to take a look at that. In doing so, that I think there's some important factors to consider, making sure that your patient, that you remind your patient not to swallow during these times is probably really important, just so that you don't get any sort of soft tissue movement or changes from the original x-ray that you did before, and having consistency in positioning as well as consistency in those kind of swallowing characteristics and the way you instruct your patient as you take these scans will make it a whole lot easier for you. So when we move into that, that we can see that now we're looking at the airway here, and let's go ahead and evaluate that. So what we want to do is we want to piecemeal this to where we can actually see this right up close. So what I'm going to do is I'm going to put this back on bone here for a second. And now we have the area here. So what I'm going to do is we have in our view, we have this thing called a VOI. VOI overlay allows us to be able to kind of just center in and taper down the 3D view. So I can actually click on this, and it gives me some dotted lines. I'm going to take down my magnification for a second. But now I've got these dotted lines. Now these dotted lines allow me to be able to center in on where I want to be. So in this case, I'm going to look at the airway. So I'm going to get the part of the airway. Now, another thing that's really important is when you make volumetric measurements especially, is to be able to have a consistency as to where you choose to make those volumetric measurements. So in this case, that we can see up to the nasopharynx, but is there a measurement in the nasopharynx that's going to be significant to your practice and what you're going to be able to do to them? Or is it going to be something that we can be able to find a point that'll be standard on every x-ray that you can take? So when you take measurements from the first time to the second time, that you can have a standard as to where that would be. So in this case, I've chosen to use it, the hard palette as my standard for where I want to take my measurements. So again, as I take these dotted lines in to center on my airway, that you can see that I've got it from the hard palette on down here. And I can go ahead and move this down to where all I'm going to be looking at is the hard palette. From the hard palette down on the airway. And then I'm going to go ahead and bring in the sides as well so that I focus in on it. Okay, so now you can see you really don't see anything here because this is just the bony prominences that are around that area. So let's go ahead and change it to soft tissue bone 1. And now we can start to see the airway as it sits in place. And again, if we went straight to just soft tissue 1, you can see the airway in profile. That's all been kind of taken away from all the hard tissue, so we can be able to take a look at that. So now in this case, we want to measure the volume of this and be able to get something, again, as a starting point for what we're going to do. Our segmentation operation, you can go inside here, you can click on any one of these, this will open it up. In this case, we're going to use grow, so we can go over to grow. And then we have some choices here. It says grow by CC. So what this means to me is that think of the airway that you're trying to fill as a pitcher that you want to fill with water. And so if you put too little water in it, you're not going to get the full volumetric measurement. If you put too much water in, it's going to stop at the barriers, right? You're going to get to the top of the pitcher, it's going to be done. So in this case, I usually go ahead and take about probably 130, just because I want to make sure that that pitcher is completely full when I get it done. So now I've grown the area. I'm going to fill that pitcher full of this many cc's of water until it's full. And I'm going to go over and I'm going to click on the area that I want to look at. So in this case, I'm going to click at this area right here. So I'm going to indicate in that area where I want to be. And then I'm going to ask it to grow. So what it's going to do is it's going to look for all the space within that area and be able to fill that up like a pitcher of water. So now that's all filled. And then what we can do is then we're going to click done. When we click done, we can have a choice of number of things we can do. We can remove the region, keep the region, restore the region, or in this case, I'm going to select it as a new object, because that way, when I select it as a new object, that when it fills in that new object, it's going to take everything else away. And this is my volume measurement right here. So this is my beginning volume measurement for off of my CBCT for the area that's there. Now, when you go back in post-treatment, you can do these same type of manipulations to be able to see that volume and see how you've made that change. You have documenting ways in which to show from part A to part B that you have done something to help out their airway in the meantime. So once you have that in place, we can also look at a couple of things here. So we're looking at fine-tuning here. Fine-tuning allows us to be able to kind of take and put some more or less soft tissue in place. So in this case, I've just added a little bit more so that I can actually give some space to this, so we can see our object here, and we can see it kind of colorized, and we can also see the shape of it, again, to show our patients and to show ourselves what's going on. Now, one of the things we can also do with that is if you are into digital printing and that you want to be able to maybe make a model of before and after, we can actually go in, you can right-click on the object to, we got the volume measurement, and you can actually save it as an STL file. Saving as an STL file will allow you to be able to get not only your DICOM from your CBCT, but your STL from, say, like doing a scan. So that in the end, you combine those two things together to be able to send it to a printer to be able to print out your airway. That gives you the ability to be able to have a hard copy to be able to show your patients that this is what your airway looked like before, this is what it looks like after. So again, just a lot of different things we can do. So kind of coming back to that a little bit, that now we've been able to put all these things in place and put all these different modes in place to where we can make an evaluation of the airway. So I wanted to be able to kind of do one as a case study really quick, just to be able to give us the opportunity to be able to kind of put a lot of the things that we've learned in the E-Series together. So in this case, I'm going to go back to one of our cases that we did earlier. We talked about orthodontia. So that, again, putting airway with orthodontia is a natural way in which to be able to evaluate the patient, evaluate what's going on with the patient. So again, I'm going to pull it up like we would get our scan, and we have an airway patient that we're going to evaluate here. So our patient downloads, and we can start to see that we have an airway here, we have some sinuses, but we want to be able to say, well, I mean, you can see this is probably the back of the soft palate, but all in this area as well is fairly small in comparison. So we can take any one of those areas to be able to evaluate. So again, what I'm going to do is I'm going to go down, be able to choose maybe this area here as an area that has some stricture to it. So we can look at that, and then I'll blow that up again, and we'll go through and be able to do our area measurement as we did before. Again, clicking on area and being able to walk through those points as thoroughly as we can. And get an area measurement of the airway at that stricture. Again, we can also be able to, and again, the way I like to do this is we can also, if you take a picture of the patient when they first come in before their scan, that we can overlap that picture so that now here's our patient. So we go to talk to our patient about what's going on. We can say, so here's your picture that when you came in, and then we can show them that this is their skeletal structure underneath. Now, as we look at the skeletal structure underneath, we've mapped out some important points for us to be able to start talking about your treatment. I can go ahead and turn the patient's head and be able to show them that this, you can see the outline of your face and all the points that are associated with here. Now, what's nice is we can change our windows. So again, in this case, we're looking at teeth here, but we can go ahead and add soft tissue to it. So now we're now seeing the superimposition of their soft tissue, as well as you can see the airway in the background. Now, again, you do have some bone in the way, so we can actually go through to soft tissue 1, and now they can see their airway in profile, so that you can be able to start explaining to them that, okay, so this is you, this is your scan, and now we're going to kind of break this down into some important points, and here's your airway, and let's kind of take a look at it and let's measure it. So we go over to 3D, and now we can make the story more complete and be able to see that measurement and say, here's the area of the airway at one of your stricture points here. So we can see that it's not a very large size in that area. But let's take a look down your airway so you can kind of see what we're talking about. You can take our CPR function, and again, choose points along the airway. Again, add some soft tissue to it. And now be able to click Airway 1. And now we're going to be inside your nose, your nasopharynx, and down into your throat. So again, we can go ahead and go through there, make the fly through, kind of take a look and see. And now as we move down, we can show them that basically from where the soft palate touches the tongue, that this is going to be your area of stricture in this area. But now you can be able to kind of show them visually where they are with it, what it looks like, and you see this is where your airway has to kind of fight through this area to get in here to go into your trachea. So it's a great way to be able to show your patients and give them some visualization. But again, it's also a real treat for you as a clinician to be able to have these type of visualizations for your own practice and being able to know what to do with your patient. So now again, going back to 3D NPR, that now what we can do is we can go through and we can say, so we've done an area measurement of your airway. And so now what I'd like to do is I'd like to be able to check out the volume of your airway before we consider treatment on you. So again, I'm going to go ahead and put some bone on there first. But again, I'm going to use my VOI function. And then we're going to go ahead and move these dotted lines. Same areas we talked about before. narrowing down the airway as much as we can. And I'm going to go ahead and take this down to the hard palate. That way I have a standard for where I'm going to stop measuring from. And I'm going to go ahead and close in the sides as well. So now that I've got that singled out, then I can go ahead and I can show them that this is your airway and profile. This is the section that we've taken out. So again, we would go to segmentation. We would go to grow. And we want to choose that area to grow. So I'm going to go ahead and choose this area right here. And now I want to grow it. I want it to fill in all that space so the picture is full. And then when I click done, then I'm going to go ahead and select it as a new object. And now we have a volume measurement. So you can see this volume is significantly lower, but this patient may be significantly smaller too. I think it's important to realize that there isn't a whole lot of literature that talks about what standard volumes are, but instead I think it's a comparative model to each human airway. So it would be something to be able to have a before and after, I think is more significant in knowing before that it was this volume and after it's going to be whatever volume you've done to correct it as well. So again, being able to make it to where your patient can see it and understand it, we would just take our fine tuning, be able to give us some flesh to our airway a little bit, so that now again we can show our patient what it looks like. And then if we wanted to create an STL to print it out, all we'd have to do is right click on object 2 in the fine tuning and save to STL. So we're able to do that as well. So for your practice, now you're able to at least move those points on. So now when we move across, now we've talked about the orthodontic evaluations and being able to take out those points, but let's even talk about occlusion. So we can talk about ways in which we can check on other ways as well, because we've learned this before in one of the other web series, is being able now to take our patient and be able to go to the orthodontic evaluation in the DVR mode. And now what we can do is we can actually look at their teeth and how they occlude to look for underbite, overbite, those type of things. And again, just gives you that many more clues as to treatment concerns that you can deal with. So again, we're going to take that, we're going to click on arch curve, we're going to go front of the tooth that we want to evaluate, try to go through the middle as much as humanly possible. Same thing with this tooth right here. When you double click, you're going to see how they occlude, so that you can see, is there an underbite, an overbite, what is their occlusion. We can go through there and do multiples of these with each of the teeth, so that you're able, again, to kind of take apart the patient, not only from the perspective of being able to look at their cephalometrics, but also be able to take a look at their occlusion to see, is there something that we can correct with maybe an appliance, whatever that is as well. So it gives you a number of different ways. Again, we could look at the TMJ. We can take a look and see if the TMJ has any sort of pathology to it. We can do a number of different things, all because of the fact that we have a CBCT that allows us to be able to not only get that visualization, but to be able to break this all apart so we can have a better understanding of what our patient what's going on with our patient and how we can treat them. So with this in mind, that I'm going to open up to the chat room. If there's any questions, I'm more than happy to answer them. Again, as I stated before, that if any of these are intriguing or any of these things that you want to incorporate into your practice, please feel free to reach out to myself or my education team to be able to make sure that they can answer those questions for you, walk you through it, give you some more training so that you have a better idea of how to be able to put all these pieces together for your practice. Again, as I said before, unless there is a request, that the plan is that this will be the last in the web series from this point forward, and then in another couple of weeks we'll be starting a new web series that will include CE credits, and that will have Dr. Kleber Silva, who's a dental radiologist out of Columbia University, and he'll be doing some CBCT interpretation classes, so that you get an idea as to what a radiologist looks for in a CBCT, and then there'll be some pathology things and whatever along the way. But again, it's a great opportunity for you to be able to have a dental radiologist actually help to give you some ideas on how to be able to read CBCT, look at it, and get more out of what you're going to get with that. So that'll be coming up in the next couple of weeks as well. Again, as I look, I don't see anybody in the chat room right off the bat. And again, these will all be recorded so that, and they'll be released within 24 hours. So again, if there's something that you missed, something you want to review, it's always available to you to be able to download and go through. And again, I like education because a good education means it's going to bring up more questions. And again, that's why my team is available for you. Okay, with this, I don't see anybody on the chat room, so I'm going to go ahead and conclude today's webinar. Again, feel free to reach out to me or my education team. And again, if there's a topic that you'd like to have covered in a webinar that you want to have, maybe, again, one question usually leads to another. So if there's something out there that you want me to be able to walk through how to do in a webinar, again, there's probably more than one person that has that question, and we're more than happy to present it to you. So again, with that in mind, I'd like to thank you for listening to our webinars throughout these last couple of weeks. I appreciate it, and have a great day.